Tuberculosis is an infectious disease which is transmitted via droplets through the air. Tuberculosis is very complex to treat, requiring a combination of drugs over a half-year treatment period.
Alikuwa anakohoa sana, lakini sasa hivi kidogo imepungua ile kukohoa.
Tanzania is a high-burden country with about 60,000 new tuberculosis cases annually. Since 2005, Novartis donates gold-standard tuberculosis drugs to all adult patients in Tanzania.
I want to thank Novartis. The last donation, I had the pleasure of actually receiving the 500,000 doses in Geneva, where we have challenges. We have a big population of people with the tuberculosis. More than a half are out there. We have not been able to identify them.
Lack of patient adherence during the long treatment period has led to the emergence of multi-drug resistant tuberculosis. To stop the rise of drug-resistant tuberculosis, the World Health Organization recommends directly observed treatment short course, in short, DOTS. Under DOTS, patients need to take their medicine under daily observation of a medical professional. This treatment approach ensures better patient adherence, but it poses a burden on both providers and patients. Already overstrained healthcare personnel face an increased workload, and patients have to walk long distances every day to receive their medication.
With tuberculosis, there is an additional complexity because it's a treatment that is over a long period, 6 months, and you have to make sure that the treatment is taken every day. Otherwise you might have resistance or it might not work the way it is expected. So you have not only to overcome the obstacles for patients going to the treatment or treatment coming to the patients, but also make sure patients are complying exactly with the way the treatment should be taken.
In order to improve access to treatment for patients and relieve healthcare providers, the Novartis Foundation for Sustainable Development, in collaboration with the National Tuberculosis and Leprosy Program of the Tanzanian Ministry of Health and Social Welfare, developed the Patient-Centered Tuberculosis Treatment Approach, in short, PCT. PCT takes the DOT strategy one step further, as it gives patients the possibility to choose their treatment supporter. They can take their daily treatment either at a health facility monitored by a healthcare worker, or they can opt for home-based treatment, observed by a family or community member.
There are quite a number of advantages. One of them is the empowering of patients to have choice of whom should supervise their treatment, as well as where that treatment should take place, either at their home or at the health facility.
Karim Ramadan and his son Adam live near Bagamoyo, Tanzania. Adam has tuberculosis and needs daily treatment. To avoid long walks to the health facility, they opted for home-based treatment.
Wasaona wewe umepata nafasi ya kufanyia kazi zako za kuwasaidia watoto. Sinaweza kama umezipangia saa moja usiku, unampa saa moja hiyo hiyo, na kesho saa moja asubuhi. Unaendelea hivyo hivyo.
Hizi dawa huwa zinakuwa na nguvu sana unapokuwa ndani ya tiba. Kwa hiyo kwenda wewe kama wewe kila siku unajikuta unakuwa umechoshwa na dawa. Kwa hiyo nikawa na msaidizi wangu ambaye siku nimezidiwa uwezo wa kuzifuatilia haupo, basi msaidizi wangu hufuatilia na kupewa dawa za siku 7.
Almost 90% of patients opted for home-based treatment, demonstrating the huge demand for the new treatment option. Patient-centered treatment also relieves overburdened healthcare personnel.
Simamizi wa matibabu kule nyumbani. Au kwa sababu mgonjwa anapata uhuru wa kuchagua mtu wa kuweza kumsimamia matibabu yake kule nyumbani. Na kwa hudumu wa afya pia inatusaidia kutokana na kupunguza pia ile population ya wagonjwa kujaa kukaa muda mrefu pale.
PCT indeed works. Recent studies show that 95% of patients being treated at home adhere to the treatment. Patient-centered treatment has now been scaled up across Tanzania.
We've already scaled up throughout the country, including Zanzibar. Each district is now implementing PCT. PCT has made a tremendous change to reach the global targets. We have shown the world that there is a cheaper way of doing business. If you are in a resource-limited setting like in this country, where you don't have enough human resource who are trained, qualified to supervise.
It will take a multi-stakeholder commitment, including governments, multi- and bilateral agencies, NGOs and the private sector, to better control and push back tuberculosis in Tanzania and beyond.